Hello, my name is Kenneth Alexander. I'm Chief of Pediatric Infectious Diseases at Nemours Children's Hospital in Orlando, Florida. Zika virus is kind of an old new virus or new old virus. This was a virus that was first recognized in Africa in 1947, but hasn't come into the public conscience until recently, when we began to see increased rates of Zika virus infection in places like Brazil. And what concerned people is that there's an association, not a proven association, but an association between Zika virus infection and women having babies with microcephaly, which is to say babies with small heads. The symptoms of a Zika virus infection vary between patients. 4 out of 5 patients have no symptoms whatsoever. If patients do develop symptoms, they typically have a rash, they have conjunctivitis or bilateral pink eye, but without a discharge. Many of them will have fevers, and many of them will have joint pains. These symptoms typically last for 5 to 7 days. So should we worry about how Zika virus affects our children? There's a couple of important points here. First off, there have been no cases of Zika virus transmission in the United States. Our mosquitoes do not have Zika virus. All the cases that we've had in the United States have been people who have traveled in other countries and come to the United States. Secondly, most cases of Zika virus, 4 out of 5, are asymptomatic, so children rarely get sick. Secondly, if children do get sick with Zika virus, their symptoms tend to be quite mild. Hospitalization because of a Zika virus infection is very, very rare. Is there a vaccine for Zika virus? Not yet. There's lots of people working on them. The federal government is investing in this, and indeed governments around the world are working to create vaccines against Zika virus. Since we don't have a vaccine, what can we do? Well, again, first off, there have been no cases of Zika virus transmission in the United States. So for those of us here, there's really nothing different we need to do. If you are planning international travel to a region where Zika virus is being transmitted, the first thing to do is to avoid mosquitoes. This includes the use of mosquito repellents and staying in places where you're not going to be exposed to Zika virus. If you are pregnant, then the Centers for Disease Control recommends that you not travel to an area where Zika virus is being transmitted. It's important that we keep track of the recommendations from the Centers for Disease Control and that we realize we're still learning a lot about this virus and that recommendations are likely to evolve and improve as time goes forward.